All right, we're good. Sweet. That's so smart. Okay. So I know that there's going to be a question about AAC. And I'm just going to go back and forth just so that I'm telling you guys the right thing from the study guide. So there's a case study about AAC, aided versus unaided. I felt like this is maybe something that we could go over. So aided AAC. And this was tricky because you don't have your AAC course yet. So I remember being like, wait, what does this mean? So aided AAC incorporates the use of a device in addition to the person's body. So I'm sure you guys have heard of AAC. I don't know how much you guys have learned about it yet and try one. But AAC is just any kind of system that helps a person communicate. So this can be like a switch that they navigate through a computer using, or it can be something like an iPad where there's all these different programs that can be loaded onto that to help them communicate. And it ranges from low tech to high tech. So just think aided, it's something that the person is getting like as like an external aid. And then unaided AAC does not require any equipment. And I'm actually just going to play this because I just realized I'm doing what I hate when professors do. So unaided AAC does not require any additional equipment, and it's just relying on the user's body. So this could be like ASL or signed English. This is also gestures, facial expressions, body language. So any kind of communication that doesn't require equipment and relies on the user's body. And then I'll just go to the next slide. Okay, so I know that there's also a question about myths related to AAC. I don't really feel like I need to go through these because they're pretty self-explanatory, but just know that there are a lot of myths. And then if we go back to her study guide, AAC myths and SLP response. So for that, if I'm recalling the final correctly, you just want to make sure that you know how you would respond as the SLP if someone came to you, believing one of these myths regarding AAC. But overall, just know that like AAC supports language. There's a million studies that show that. It supports language and it can like foster more language development in comparison to not using AAC at all. Okay, another topic. And maybe you guys go ahead. I didn't know if someone said something. Guys, I'm not able to see the chat. I'm just like not that technologically advanced. So if someone has a question, just ask.
Yeah, I think you're good so far.
Okay, thank you.
Yeah.
See, and now I can't get out of this. Oh my God, now I've really done it. Sorry, guys. Okay, so pre-symbolic and versus symbolic. I felt like this was another kind of confusing topic. So I'll go over this a little bit more. So pre-symbolic communication is the emerging communication. Think of this like, just think of babies and how do babies communicate, right? If you've ever been around children or babies, you understand that they have unintentional behaviors like crying when they're hungry, or intent. I think this should say intentional, guys. They have intentional behaviors like they cry when they're hungry. You can tell by a baby's body language how they're feeling, right? So think of pre-symbolic as the pre-communication, and then symbolic is the communication that happens over time. And it becomes increasingly intentional. So a child that is using a block for a baby doll bed, they have an idea of what this block represents, and they know how to communicate that through play, and through their communication. So there's symbolic play, which is kind of what I just described, and then symbolic gestures. So those develop later, used to establish a reference or indicate semantic contact. Okay, so that's like when a child is waving to say bye, or gesturing using hand motions to different songs. So pre-symbolic, early stages, this is what they're doing when they're crying, when they get hungry, when they're having different facial expressions. And then symbolic is happening later on. And just stop me if you guys have any questions. Okay, types of intervention approaches. I'm going to just read this really quick. Okay. So directive. So this is more adult-led and focused on discrete and specific communicative behaviors. So there's variations of prompts or cues. Prompts as natural as possible, individualized for the client. And then there's responsive, so a responsive intervention approach. This is when you're attempting to encourage a child to engage and you're providing opportunities for kind of the child to initiate and the child to direct the behavior. So modeling a target without requiring a response, that would be like if a child is reaching for something and they're going, and you would say, oh, juice, you want more juice, or you're saying juice, please. And that's not requiring any response from them. You're still giving them the juice. You're following the child's lead with that. And then hybrid. So this is a blend between directive and responsive intervention approaches. Heavily emphasize manipulating the environment to promote communication in a natural environment. Okay, so these are things like sabotage. So say you have a blue marker and the kid says that they want blue. And I say kid, but this can really be any age. And then you hand them the green on purpose. You're sabotaging that situation. So then the child is going to have an opportunity to communicate. They're going to say, no, I wanted blue. And there's all those different strategies there. So providing choices, changing a routine. Strategies are combined with manned model, expectant delays, and incidental teaching. And I think manned model comes up in a little bit. I can't quite remember what that is right now. Okay, so then there's extension and expansion. I remember this being pretty tricky. So this is kind of just like a little summary that my friend and I wrote out when we were studying. So extension are replies that build on an action or utterance by providing additional information. That's where like the extension comes from. So it can be in the form of comments that add some additional information to a child's utterance. My friend wrote this, adding extension to your hair, you are adding information. So that's a way you could remember it. Pretty much how I've gotten through grad school is like thinking of different little ways to remember things, especially in neuro, which I think you guys are taking right now. So that's just a way to remember that. So an example, a child says, throw ball, the clinician might say, throw ball high, throw big high ball. So things like that, you're providing additional information to the child's utterance, which is really tricky because expansion is similar, but with expansion, just think you're providing a more grammatically correct form while still maintaining the child's word order. So you're expanding to what they already say. So if they say eat cookie, you say, you eat cookie, or you're eating, let's see. So anything like that, eat the cookie. So expansion, think grammar, and extension, think additional info. Okay. Scaffolding. So I'm just gonna summarize this. So when I think of scaffolding, I think of it as you kind of are seeing what level a child is at, and then you want to like bring them to the next level. So I don't know if you guys have learned about not wanting to provide a child with something that's too difficult. It's like above their learning, and not wanting to make it too easy because then it's boring. So I kind of think of scaffolding with that, where you provide something for the child. And let's see, this is from Dr. Foy herself. So there are many ways to scaffold: providing appropriate vocabulary for the child when they're using a simpler word, asking questions, extending, offering the first part of the sentence to be completed by the child. Like you can do this a lot when you're reading, providing a cue. So these are all different ways that you can scaffold a situation. But think of scaffolding as the SLP is incorporating a prompt or cue to bring the child to the next level of language. I hope that makes sense. That's kind of a tricky concept that is still hard to explain, but once you actually do it, it does become a lot easier. Let's just check really quick. What?
I have a question.
Sure.
Where do you see that in the study guide? This is like scaffolding as one of the.
And this was, let's see. I'm looking at it right now. And guys, if there's something in this PowerPoint that's not on the study guide, yeah, you can.
I know
Just,
expansion was also, but I didn't see extension. So I want to about those two, scaffolding and extension.
I'm looking right now. Oh yeah, you guys can see my screen. Yeah, I don't see it on here. There's expansion. I know that this is based off of like the final that we took. I'm not sure if you guys like absolutely need to know like expansion versus extension, right? Like she might have put expansion on the study guide because the question will be like maybe the answer will be expansion, you know what I mean? Like it will be like expansion versus extension, and she wants you to really know expansion. But yeah, I would really focus on what is on the study guide. And if there's extra stuff in the PowerPoint, I wouldn't like add anything to your study guide unless you want to. Does that
From
make
like from your experience, like is it like basically all what she puts in the study guide? Or
I can't exactly remember the final. I'm gonna have another study session, and I can go in and see and just make sure that like all of the concepts on her study guide are there. But I know that I studied the study guide provided. I had another professor, but it was the same study guide. So if you know it's on the study guide, you will be good, is what I will say.
okay, thank you.
Yeah. But yeah, if there's something on here that's not on it, like don't add another thing, but have like a general knowledge of it, and I think you should be good. Okay. I'm gonna make sure that these things are on. So compare, contrast, modeling versus telegraphic speech. Let's make sure these things are on because I don't want to give you guys more. Telegraphic speech. Okay. Okay, so telegraphic speech, children's earliest word combos where components of grammar were omitted. If you've ever been around a child, you know that obviously children are not speaking in grammatically, syntactically correct sentences. So, telegraphic speech, there's a debate over it because it does simplify speech, and you do want to include all those different parts of speech, right? Like you want to have nouns, you want to have verbs, you want to expose a child to all of that. So that's kind of where the debate is. Like, do we speak to a child in the same way that we're speaking to them? Well, no, not all the time, right? But when you're reading a book and there's a dog and you say, doggy, go, that's not grammatically correct, but that's kind of where that debate comes from. And I think that you guys might have had like some articles on that. I can't remember. increased pitch. And then here's kind of like people who are for telegraphic speech would say that the increased pitch, the loudness, and the slower rate has been shown to facilitate language and has been shown to facilitate comprehension. So may actually be that how something is said is more important than what is said. I do remember reading this article. So it's not really about what is said, but how something is said, has an effect on how a child is going to acquire that language. And then language modeling. I feel like this is a pretty easy one. So model what the child might say in natural interactions. So like if you're with a child and you are trying to get them to maybe like greet people, then you would just model that greeting, like, oh, hi, mama, mama's home now. Hi, mama. And you're modeling what you want them to say. I feel like modeling is such an important thing. And you guys will learn like a ton more about that. Let's see, there is some lack of knowledge / myths about teaching children gestures and signs. Does it hinder language? So of course, no. Teaching gestures and signs does not hinder language. This is kind of similar to like using AAC. That is not going to hinder language. It's always just going to like facilitate and support language. Okay, use of gestures and intervention. Strategies for teaching gestures. Okay, so all gestures have a function, right? Like there's a reason behind a gesture. When we wave goodbye to somebody, there's a reason behind that. So we'll go through requesting, rejecting, and then pointing. So requesting, it's an extension of reaching. So if a child is already reaching, keep things out of reach. And then you can ask them, what do you want? So that's how like you could take a child's gesture and prompt for language. Rejecting / protesting, use of a behavior to escape from or avoid objects, activities, or social interactions. So the goal with this is to provide the child with an effective and like socially acceptable strategy for getting out of stuff that they don't want to do, right? If a kid doesn't want to do something and they just throw their cup on the ground, well, how socially acceptable is that? That gesture, right? Like our job is to increase like social interactions and increase effective communication. And then pointing, a way to draw attention to something. An early form of conversational comment or reply. So yeah, we know that pointing is one of like the first things that a child will develop. So they might be pointing to where, sorry guys, that should say to where things go, pointing to puzzle pieces, pointing to things that they want. And then some strategies for teaching gestures. It looks like this is not filled in, but I think that you could use like all of these functions above to teach a gesture and to teach like a strategy, if that makes sense. Hopefully. And I don't
And
think
use like the binary choices to offer like a choice so the kid can point at something specific as well.
totally.
Okay.
Yeah, that's great. Like, and I feel like a lot of what we learned in ELD and a lot of like the content in this class, like I remember reading the book and just being like, this is a lot, but there's so much overlap between things. And that's kind of just like a little side note and a tip for school is just when you're learning about stuff, like it doesn't just fit into one box. So like right now we're talking about why children use why children use gestures. But yeah, like providing binary choices is like a great thing to do in therapy with any kid who, maybe doesn't want to communicate. So there's a lot of overlap between topics, which makes it like a little more difficult to study, I feel like.
I'm not sure if you know, but it does say you only have 9 minutes left for this recording.
Yeah, I saw that. It's terrible. I should really probably just like upgrade this, but let's see. We have 1, 2, and I can totally share this with you guys too. And maybe like I'll go over the rest of it in like the other review. But yeah, we'll just keep going on this because I think the rest is about an assignment. Here's some strategies. Oh, here's SMART goals. That's good stuff. Tutoring session 1. See, this was my friend's. Interesting. Okay, not that much more. Thank you though for that. We're definitely gonna get kicked off. Okay, so I'm not gonna read through everything. I can totally share this with you guys. Okay, so guidance for caregivers of children in bilingual homes. It is a myth that children with communication impairments who are exposed to 2 languages do not demonstrate additional delays when compared with monolingual children. So there's so much information about bilingualism, and I'm not sure what exactly is going to be on the final, but just know kind of like what you would say to a parent who English is not their first language and they're worried that speaking their native language is going to impair the acquisition of like their L2. So their L1 is right, the language that you are speaking with your family when you're young and it's your first language. Then your L2, like having exposure to both of those languages is not going to do anything other than facilitate and support language in every way, because language is in the same spot in the brain no matter what language you're speaking. So kind of know, I think for this question, like what you would say and kind of like your reasonings why, and what kind of guidance you would give. Okay, children with communication deficits can develop bilingually and need parental input in the language of the home. English input will occur in school. Yeah, and like you guys will see this in your placements, or if you've ever worked in a school, that parents get really worried about this. So a lot of this exam, and I mean just in school in general, just like really think about like what you would tell a parent, and like you would never say like stop speaking your native language, right? And like if you just like rationalize that and think through that, like, well, why? Well, because exposure is just, it's great all around. Let's see, bilingual children, you guys can just read through that. And then that's pretty much what I just went over. Like, what is our role as the SLP in navigating through that? Our role is always to like educate and inform and provide, you know, research-based information and support our families and clients, yada, yada, blah, blah. Okay, other topics to review. Let's see. I think that most of these are on the study guide. If there's something on this that isn't on the study guide, I would just not worry about it. We're not going to go through all of those because that's a lot. Ignore that. This is about previous assignments. Okay, here is some here's some good examples in the book for symbolic early communication. And I think you guys have the same book, I'm almost positive. So that is good to know. This was for that previous assignment that I think you guys maybe had like 2 weeks ago. Okay, here are some scaffolding strategies. There you go. Binary choice, first one. So I'm not going to read through all of these. I feel like you could also like, it's terrible to say, but you can use YouTube and look a lot of this up. I know we're paying a lot of money to be in a graduate program, but that's just using your resources, and YouTube is so great for looking up things like this and having like that direct video example. I feel like that really helped me. If you can provide an example, you understand the strategy, and like even not just these strategies. Okay, here's some stuff on SMART goals that I'm not going to go through because we don't have time right now. Here's an example. we're gonna ignore that. We went through that. Okay, do you guys have any questions that you like really don't understand from the study guide, or that you want to talk about it in our 4 minutes that we have left? I'm happy that someone asked me to record this because that was a lot of information. I hope I didn't overwhelm you more. Oh, here's a good slide. Individualized. So this is the IFSP. I think that this was maybe a case study on my final, but that's a good thing to know. Just trying to see if it's on here. Okay. How do you guys feel? Was that at all helpful, or was that just really overwhelming?
It was helpful.
Okay. Do you guys have any questions or anything that you want to go over from the study guide that you're confused about?
Not specifically. I just think like talking about it helps me understand it and like puts it better in my brain. So just thank you for going over all this.
Yeah, totally. I agree, and I definitely didn't realize how important that was at the beginning of like try one. But I like have a few friends in the program, and we would get together and just plan a time that we could talk through things on Zoom, or even talk through assignments, or, you know, how are you formatting this? Or like, I feel like with ELD especially, there was so much information and I just wasn't sure like what was going to be on the final and stuff. But if you can talk through the things in the study guide with someone and provide examples and kind of like look at videos, I think that's the best way to study for sure, at least for this class. I mean, neuro might be a little bit more like just memorize that stuff. But even that, if you can talk through that. Do you guys go ahead?
Has Dr. Foy told you if we get a 1-page like in our midterm?
Someone brought that up at the beginning of the study session, I think.
It's in there. If you go like on Blackboard and you go to the last week final exam, week 15, it'll tell you that you can use that. You have to show it before you take the exam.
Can't hear you.
Oh.
Here, I can reiterate it.
She said it just shows in the overview of week 15. If you go and look, it shows you that we can use 1 page front and back, just handwritten. And then we have to do the same thing as last time, show the respondus, like the front and back of it.
Okay.
Yeah, for that, that's so nice that you guys have that. Okay, we have 1 minute left. Let's see. What was I just gonna say? Sorry, guys, lost my train of thought because somebody had to walk behind me. Would you guys want a copy of that PowerPoint?
Yes,
I can-
please.
Yes, please.
Okay,
Yes.
sounds good. I will take some things off of that, like my friend's name, and then I'll share that with Dr. Foy, and then she can post that. And then the next study session that I'm doing, which I think will just be like asking questions and discussing stuff, is going to be Wednesday at 9 a.m. And we're gonna get booted off here in like 5 seconds, but 9 a.m. Mountain Time. I'm in Colorado, so I hope that was helpful for you guys.
Thank
Thank
you.
you.
Thank
Yeah.
you.
Email me
Thank
with
you
any
so much.
questions. It's r.freund@usa.
Thank you. Have a good night.
You guys too. See ya.